Hello and welcome to my audio Medical Basics, where I read medical books to your ears when your hands are too busy to hold a book. If you like, please don't forget to like, share, and subscribe. Now, let's continue from my case files book collection. And today we'll start with the case files book of Psychiatry. As you can see. We'll do one case from Psychiatry, and maybe we'll do one case from the other books. We still have surgery, pediatrics, and obstetrics and gynecology. We'll do one case of each just to showcase the books. Maybe we'll do it as a cycle, like 3 cases of emergency medicine, 3 cases of internal medicine, and then 1 case of each of the other books. Because internal medicine and emergency medicine are really the most important, I guess, with the most cases. The others are important too. Well, you tell me in the comments. But for now, we'll do this cycle maybe, and maybe we'll do other books later. So, our case of Psychiatry today, we'll start with the case of major depression, a recurrent major depression. So, summary of the case: a 42-year-old man complains of symptoms of major depression. He has history of 2 prior episodes he experienced in the past, which were identical to this one. And previously, he was successfully treated with a tricyclic antidepressant, TCA. This tricyclic antidepressant was imipramine. This class of medication often produces anticholinergic side effects such as dry mouth, dry eyes, and constipation, which this patient is complaining about. So this patient came back to your office and he wants treatment of the major depression he has, but he wants to avoid using tricyclic antidepressants due to their side effects. So what is the best therapy? The question was, what is the best therapy? The best therapy is a selective serotonin reuptake inhibitor, SSRI. Example for these is sertraline, paroxetine, citalopram, or fluoxetine. These are one of the first-line choices of medications for this patient. So, best therapy, a selective serotonin reuptake inhibitor, SSRI, such as sertraline, paroxetine, citalopram, or fluoxetine, is one of the first-line choices of medication for this patient. So the other question was, what are the common side effects of the proposed therapy? So the common side effects are gastrointestinal symptoms, such as stomach pain, nausea, and diarrhea. These occur in early stages of the treatment. There is also minor sleep disturbances, either sedation or insomnia. This can occur also. And other common side effects include tremor, dizziness, increased perspiration, and male and female sexual dysfunction. So the objectives of this case: to understand the treatment of uncomplicated major depression without psychotic features, and to be able to counsel a patient in regard to the common side effects of selective serotonin reuptake inhibitors. So, considerations. Although the patient has been successfully treated with tricyclic antidepressant, which was imipramine, he was successfully treated 2 times in the past. These medications are no longer considered first-line treatments because of their common side effects and their potential lethality in overdose, causing cardiac arrhythmias. For a patient such as this one might consider using imipramine again. However, the patient specifically requested another type of medication because of his previous discomfort with the side effects. One of the current first-line treatments for the patients with major depressions, selective serotonin reuptake inhibitors, are thus the logical choice. They have fewer side effects and are safer. So we have here a table about table explaining the diagnostic criteria for major depressive disorder, recurrent. So, 2 or more episodes of major depression diagnosed by the following. 5 or more of the following symptoms have been present most of the time for at least 2 weeks. So 5 or more symptoms present most of the time for at least 2 weeks. They are 1. Depressed mood. 2. Anhedonia. 3. Significant weight change or change in appetite. 4. Insomnia or hypersomnia. 5. Psychomotor agitation or retardation. 6. Fatigue or loss of energy. 7. Feelings of worthlessness or excessive guilt. 8. Decreased ability to concentrate or indecisiveness. 9. Thoughts of death or suicidal ideation. There has been never a manic, hypomanic, or mixed episode. Symptoms cause significant distress or impairment in functioning. The symptoms are not caused by a substance of abuse, medication, or a medical condition. Symptoms are not better accounted for by schizophrenia, schizoaffective disorder, delusional disorder, or a psychotic disorder not otherwise specified. Symptoms are not better accounted for by bereavement. Example, symptoms last longer than 2 months, marked functional impairment, suicidal ideation, and or psychotic symptoms are noted. So, that was the table of diagnostic criteria for major depressive disorder, recurrent. So, approach to major depressive disorder, recurrent. Definitions. Anhedonia. Anhedonia is loss of interest or pleasure in activities that were previously pleasurable. And we have selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitor, SSRI, is an agent that blocks the reuptake of serotonin from presynaptic neurons without affecting norepinephrine or dopamine reuptake. These agents are used as antidepressants and in treating eating disorders, panic, obsessive compulsive disorder, and borderline personality disorders. So, the clinical approach of such patients. Major depression is a common problem. Women are affected twice as often as men, with a mean age of occurrence at 40 years. A common hypothesis concerning the etiology of major depressive disorder involves the alteration of biogenic amines, particularly norepinephrine and serotonin. Genetics plays a role as evidenced by family studies. A mnemonic is helpful in remembering the criteria for an episode of major depression. As lack of energy is common to most of these episodes, the mnemonic relates to treating the symptoms by prescribing energy capsules and is written on a prescription as SIG equals E caps. SIG, E for energy, then caps. Just remember, SIG, E caps, SIG caps. Each letter stands for a criteria except for depressed mood. So each letter stands for a criteria used in diagnosis and episode of major depression, except for the depressed mood. So, SIG caps. S for sleep changes. I for interest, it is decreased interest. G for guilt, it is excessive guilt. E for energy, it is decreased energy. C for concentration, it is decreased concentration. A for appetite changes. P for psychomotor agitation or retardation. And S for suicidal ideation. Okay, so SIG caps. Okay, suppose this is all for part 1 of the psychiatry case file of major depression, and we will continue in part 2. And for now, no.